What is another person's freedom worth to you?
Human trafficking is made up of two subsets, labor trafficking and sex trafficking. Labor trafficking is defined by the Trafficking Victims Protection Act as the recruitment, harboring, transportation, provision, or obtaining of a person for labor or services through the use of force, fraud, or coercion for the purpose of subjection to involuntary servitude, debt bondage, or slavery. This is commonly found with domestic servants, farm workers, and factory workers. Sex trafficking is defined by the Trafficking Victims Protection Act as recruiting, harboring, transporting, providing, obtaining, patronizing, or soliciting of an individual through the means of force, fraud, or coercion for the purpose of commercial sex. It exists in many unique places, including fake massage businesses, escort services, residential brothels, and in truck stops, strip clubs, hostess clubs, hotels and motels, and elsewhere.
Okay, here are some stats for human trafficking. 43% are trafficked for just the purpose of sex, while 32% are trafficked for the purpose of forced labor. Women and girls make up 56% trafficked for the purposes of forced labor, while men make up 44%. Women and girls make up 98% of sex trafficking, while men and boys comprise of 2% for sex trafficking. It's also estimated that U.S. citizens make up 25% of global child sex tourists and make up to 80% of child sex tourists in Latin America. 88% of victims have contact with at least one health professional at some point during the period in which they have been trafficked.
Human trafficking is a nationwide problem in the U.S. with reports originating from all 50 states. Nurses are well positioned to identify suspected victims of human trafficking. Healthcare visits usually occur when there is an illness that prevents them from working, recurring STIs, positive pregnancy tests, and abortions. The individual may appear frightened, depressed, or anxious. Other signs include outbursts of anger, intense shame, self-blame, self-loathing, and hypersexualization. The story of a patient's job, lifestyle, or how they arrived to the country may be inconsistent. Physical signs may be subtle, such as muscle strain, headaches, dizziness, back pain, or STIs. More significant signs include repeated abortions, bald patches where the hair has been pulled out, bruises, burns, bite marks, or vaginal and rectal trauma. Unusual tattoos or branding marks may signify that the patient belongs to a certain trafficker and should be noted.
So now we'll discuss the challenges associated with human trafficking. The first one being the often hidden nature of this crime due to the trafficked minors. Next will be that the victims are often reluctant to disclose victimization or seek services and or participate in research because of fear. And now this fear may be due to retribution from traffickers, fear of law enforcement, fear of being identified as criminals. Another challenge is the shame and stigma surrounding trafficking, the lack of accesses to services, and they may not be able to they may not identify themselves as a victim, and the belief that they may not be believed or that they will truly not be protected. Another posing challenge is that there's a lack of uniform, centralized and an integrated system for tracking due to the legal and policy barriers to the collection, sharing, and analysis of trafficking data. There's also a lack of training and identification by law enforcement and service providers. And last challenge is that there are issues with collecting data from trafficked youth in particular, such as from informed consent from parents or guardians, as well as concerns regarding further exploitation and accessing potentially vulnerable youth who are homeless in the foster care system or have been adjuncticated.
In our research, we found that there is no one best practice for human trafficking resolutions, but there are tools that exist to aid in identifying if a person is potentially being trafficked. Some questions that may be asked in the Trafficking Victim Identification Tool may include, have you ever felt you could not leave the place where you worked or did other activities? Have you ever felt you could not leave the place where you worked or did other activities? Did anyone where you worked or did other activities ever trick you into doing something you did not want to do? So these are just a few of the questions that may be asked in a series of many interview questions. Some interventions that you may include when you come across a patient may be individual screening if they're at a high risk category, with any validated screening tools such as the one we just mentioned. You want to create a setting of confidentiality for the patient to show them that they have a boundary of privacy. You may need to communicate with law enforcement in appropriate situations on a case-to-case basis, and you must be transparent about the need to mandatory report such things in cases of minors. You may end up using the ABCD model of treatment, which is assessment, buy-in, which means are they answering your questions, making eye contact, agreeing to get help, case management, and diversion programming. You will also potentially need to perform a physical assessment on the patient with their permission, making sure to keep them aware of what will happen at every point of the assessment, making sure to not make them uncomfortable.